Greg was somebody that was enthusiastic about learning. He was always focused on how to have solutions to problems that he identified or challenges that were out there. And he took up flying. He was a private pilot that really enjoyed the freedom that came along with it as well.
As a family, we were like a lot of Canadians or Albertans are, and didn't really think that much about the healthcare system prior to Greg's death.
We only really knew of Greg's challenges for 6 days. That's when he admitted to us that there was a chance that he had testicular cancer. He was scheduled for surgery on Wednesday, and Saturday he passed away.
In a number of instances in his journey, he was waiting to hear the status of a test or the next appointment, and so he fell through a number of cracks in the system.
It was a big shock to us that he passed that quickly, and for that reason, it left a lot of questions for us to investigate and try and understand.
Eventually, we were connected with the Health Quality Council of Alberta, and they did an investigation into Greg's journey. When the report was released and those recommendations were put out there as a sort of a path forward for what the system should be doing, and a number of those recommendations focus on the flow of information. We ended up creating the short film, Falling Through the Cracks, Greg's story.
The film starts at that first pilot's medical and then shows the events that Greg was involved in right through until his death.
The film does a good job of outlining why we need a patient-centric healthcare system and really the need for true patient partnership and really enabling good teamwork in healthcare. We recognized that access to information was a critical piece to being able to move forward to a better healthcare system. The film does such a good job at sparking discussion. Over the last year, we've done more than 200 screenings with a variety of different audiences.
The most powerful part of that is the post-viewing conversations that happen between different audience members and the different communities that are there.
When the opportunity to do the film project came up, we decided that that was the trigger for formally creating the organization, Greg's Wings Projects, which is a not-for-profit organization that was created to honor Greg. Greg would have seen this as a challenge that was worth taking on. He loved his rural community, he loved playing sports, he really loved innovation.
The most important thing is for the patient to recognize they're not just a passenger. And the system should recognize their best asset in that care team is the patient and their family.